All right, it's just loading.
Okay.
Okay, there we go. So we're now
All right,
live.
it's just loading.
Okay.
Okay, yeah. So we're now live. We'll just give it until like 7:05-ish for people to start coming in, and then we can get started.
Okay, great.
Yep. So there's already questions coming in. I'm just gonna post them in the chat, and then you can just answer them once we start.
Do you want me to wait to answer that one, or whenever, like when we start? Yeah. Okay.
Yep.
Sounds good.
right, I think we can get started. So hello everyone. Welcome back to My Medical Message. Today we have Rose Griffin with us. She's an autism speech therapist and she's here to speak with us about autism and autism speech therapy for our season 3 Autism Awareness Month of April. So welcome to My Medical Message.
Thanks so much for having me, everybody. I'm very excited. Tonight, I'm going to be talking about my role as a speech language pathologist, or SLP, and a board certified behavior analyst. I have both of those certifications, and I'm excited to share more about what that means. So I'm tuning in today from Ohio, and I don't know where you're tuning in from, but today it actually snowed it's been like very hot. I put everything away. I have 3 kids. I put everything away, all the boots, coats, and all the bathing suits are out. And then it completely snowed today. So that was kind of funny. I put that on my Instagram story. Okay, so today what I thought we could talk about is, what is a speech language pathologist? We're going to talk about what is a board certified behavior analyst. And those are kind of the short terms that you may see referred to. I'm going to talk about my journey in being a speech therapist and then also becoming a board certified behavior analyst and having both of those certifications. There are less than 450 people in the entire world who have both of those certifications. So it's pretty rare, and it's an exciting group of people. We call ourselves unicorns. I think that's kind of a name that just kind of came up because there's not a whole lot of us. And so I want to tell you more about that. We're going to do some case studies and then just some general recommendations about autism. Should you be working with any autistic individuals? I'll talk a little bit about work-family balance. I do have 3 kids, and I'll answer questions too. So a little bit about me. I am a speech therapist and I work 3 days a week in a public school as a public school SLP. And prior to starting my own company, almost 4 years ago, I always split my time between a public school and then a non-public program for students with autism. Typically, these non-public programs are for students who have unsafe behavior or have behavioral barriers that causes this non-public program to be their least restrictive environment, or where they can be educated appropriately. And so I've always kind of had a toe in the public sector and the private sector. And then I started my own business almost 4 years ago now called ABA Speech. And in that business, I provide therapy. I have a podcast called Autism Outreach, which we just started in January. It's all about autism and communication. And we provide therapy services, physical products, and everything related to helping autistic students increase their overall communication skills. And so that's what I spend my time doing. And I do a lot of public talking and presenting, and I really enjoy this. When I'm not doing all of those things, I'm hanging out with my 3 little ones, and my husband has them all, and they are all upstairs. Hopefully they will stay up there. Okay, so let's talk about what is an SLP. A speech language pathologist works to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. So when you're a speech language pathologist, your undergraduate degree is in something like communication disorders. And then once you decide at the master's level, do you want to become a speech language pathologist, or do you want to become an audiologist? That's kind of how it goes, is you're making a decision after undergrad. Do you want to focus on speech and language, or do you want to work on hearing and be an audiologist? And so speech language pathologists do all different types of things. And I think that's something that really attracted me to the field, is that it's such a broad scope of practice, and we can do so many different things. I remember my mom gave me a career test when I was in high school, a senior in high school, and one of the things that came up was speech language pathologist. I didn't know what a speech language pathologist was because I was never in speech therapy. I don't know if I had any family members that were in speech therapy. So I did an observation with a family friend who was a speech therapist. And it was an amazing day. We were in a school, and then we did a home health visit with an older individual, and then we went to a nursing home. And I thought, wow, this is really an amazing profession. You get to help people. It's science related, but there's no math involved, which is probably why I didn't go into medicine, because I'm really not great in math. And so I knew that was going to be a barrier to me doing anything kind of as a doctor or anything like that. So it really kind of fit that for me. And it seemed like it was a good work-life balance, because I knew that I always wanted a family, you know, hypothetically one day. So it's really nice. You can work with kids, you can work with adults. There's a lot of different things that you can do being a speech language pathologist. So speech therapists treat a variety of clients, but not limited to. So speech disorders, I think this is what we typically think of as speech language pathologist, is somebody who is helping somebody who cannot make their speech sounds. So, you know, somebody who's having trouble with making the K sound. I have a client right now who is having trouble with that. And so we're working on that. These things are very, very common. And I think that a lot of kids get speech therapy when they're younger for these types of things. Speech sound disorders, accent reduction is another one. That's something that's very, very interesting. I went to Kent State for my master's. And so one of the things we did is we had an accent reduction clinic. We had people that we were seeing in the clinic. We were graduate students, and we were seeing students that were coming in from other countries, and they were teaching undergraduate and graduate courses. And they were working on their pronunciation of speech sounds of the English language. And we also had, I worked with somebody who was a PhD level engineer at a company here that was based in Akron, Ohio. And you know, the language that was his native language didn't involve the same sounds. And so it was really hard for him to make a difference. I remember wiper, viper. In his particular country, one of those sounds didn't exist. And so we worked a lot on that, because he didn't want his message in the workplace to have people not being understanding him. And so we worked a lot on that. And it was really, really cool. I used to think a long time ago that I wanted to go into corporate speech pathology, because that's a whole field that people go into. And I think it's really, really fascinating. Stuttering is another thing that speech therapists treat. So stuttering would just be any kind of disfluency that people have. And that's something that kind of ebbs and flows. We're not sure why people acquire stuttering. There's a genetic tie. And it's something that people can be fine one day, and then the next day they have a lot of stuttering moments. And so that's something that I was just talking about that with a colleague today. Stutterers kind of need that continued support. Social communication can be all different types of things. And I kind of think now with COVID and our reliance on our phones, if you've ever been in a Starbucks line and you've seen people, people nowadays don't make a lot of small talk. Even before COVID, I really think that the phone, as much as I'm on social media all the time, I do think that has decreased our social skills. And I think that can carry over into the workplace. So I think that as our phones become more important in social media and all those ways of communicating, I think in real life, communication is so important. And I think that it's something that speech therapists are going to be treating more and more, just because of kind of how the world is right now. Swallowing disorders. So sometimes people have swallowing disorders for all different types of reasons, sometimes after a stroke. Sometimes people have feeding concerns. That's very specialized. Autism, that's what I specialize in, is helping students with autism. And then we touched on accent reduction. So it's a very, very broad scope. Another thing that I think is really wonderful for speech therapists is that you can work in a variety of different settings. So like I work in a school, you can work in a specialized school like I talked about, a public school, hospitals. When I very first started out, I did some PRN in hospitals, which really is not my thing at all. I do not like hospitals. I don't know, you just kind of get in your groove with what you like. It's definitely not my jam, but I did do it when I first started. I thought it was very cool. So you'll see speech therapists working in collaboration with all different types of people, especially for swallow studies and things like that, nursing homes, and then also in private practice. So private practice is a very big thing. Sometimes people have private practices that are very general and they see all different types of people. Sometimes private practices are very niche. And like my private practice, we just see students who are younger, and preferably students who have autism. That's kind of what we specialize in. So that's kind of in a broad sense, that's what a speech therapist does. Should I answer some questions now, or do you want me just to keep going? Yeah, answer some questions? Okay, so let me go into the chat and look at some of the questions that you have. One of the first questions was, has COVID affected your workplace? And absolutely. So when COVID hit, um, there's this idea of teletherapy. So most speech therapists work with clients face to face, but we know that telehealth and teletherapy, that's really growing. I do a lot. I have a kind of a decent sized social media presence and now with the podcast. So I get people from literally all over the world who want to talk with me about autism. And so I love that. I love being able to talk with professionals and parents who maybe don't have speech therapists in their country that are as well versed in autism. And so even before COVID, I was doing telehealth and consultations, but COVID has really changed things. So a lot of speech therapists are doing teletherapy now. So that just means seeing a student just like I am across the screen. When COVID hit, a lot of speech therapists had absolutely no clue how to help serve their students for teletherapy. And so there's a lot of education. And on my website, avaspeech.org, we have a course on teletherapy because speech therapists really just didn't know how to help their students in that way. It's not something that we've ever had to do. So that was a really good question. There's no cure for autism. Sometimes you may hear a lot of stuff online about, autism has been cured. Everybody has a different definition of what that may mean, but there really is no cure. Can autism improve as the individual ages? Absolutely. And with the right amount of therapy, and we really, I think our main goal for autistic individuals is to just help, and any individual I work with, is to help them become as independent as they can be across all domains, not just communication, but communication is obviously my niche area. And usually it's a team-based approach. So for somebody to diagnose autism, usually a student is going to a neurologist and they're doing a complete battery of tests. And then from that, we would say, yes, this person has these characteristics. They do fall into what we would classify as autism. What is the biggest thing you have learned through your profession and working with others? So I think just being collaborative and listening to others and working together as a team, especially for students who have more complex needs. I work with students who have a whole range of disorders, not just autism. But I think that when we're working with students who are also working with teachers and are working with maybe an outside provider and are working with an occupational therapist, that really that communication piece is probably one of the most important things to think about. What is the most memorable experience you've had with a patient? I'm going to talk about some of those experiences today, but I had a student that lived in another country for 10 years and moved back here with different family to the United States. And when I met him in 6th grade, he had no way to communicate. The student did not have a lot of problem behavior, which was good. This is one of my case studies, so maybe we'll get to it. But he started verbalizing in 6th grade and started talking, and that was exciting. I've presented about this case at conferences. I've written in professional journals about this particular case. What was so exciting about it is that most times when a student is that advanced in age, they don't always acquire verbal speech. And even if they do, it may not sound like our speech. But this student was able to say most of the speech sounds that we say, and it was very, very exciting. Okay, I'll answer 2 more questions and then I'll get back to the presentation and come back to these. When did you first realize you wanted to pursue this career? Was this job what you expected? Was it harder or easier? My mom gave me a career test that really kind of sealed the deal for me, and I just did my major and that was it. Like, never took a class I didn't need to take. I'm very type A and organized. Most speech therapists are like that, very type A. And so I just kind of pursued it like that. It's exactly what I expected. And I don't know. I wouldn't say that it's easy, but I really love doing it. So I've been a speech therapist for 20 years and I still really love it. So I think that's a good thing. Okay, so I'll come back to some of those questions too. So that's kind of the speech therapy side of my life. And now I want to talk about what a BCBA is. Applied behavior analysis is a science, and you may have heard of, B.F. Skinner, who we probably all learned about in Intro to Psychology. Is definitely somebody who's important in that field. And so, so this field is really rapidly growing, and there are a lot of providers who are providing ABA. applied behavior analysis to help students with autism increase their skills. And so that's kind of like a whole different field. And so what a BCBA is the board certified behavior analyst, that's BCBA, is a graduate level certification behavior analysis. Professionals certified at that level are independent practitioners who provide behavior analytic services. So when I got my BCBA, and because the field has grown so rapidly, but because I've had my BCBA for so long, when I got my BCBA, they accepted my master's in speech therapy. And then I went on and I took 15 credit hours of applied behavior analysis. So I learned all about research and design. I learned about the science of applied behavior analysis. I learned about verbal behavior. I learned about ethics. There's a whole class on ethics, our ethical code. I actually teach that class here at Kent State. And then I had to do so many hours in the field, and I had to have a supervisor who already had their BCBA. And then I had to take a test that's like a really hard test. It's called the BCBA exam. And I think only 60% of people pass the first time. So it's pretty tough. And that's how I became a BCBA. Then once I became a BCBA, they kind of changed things. And then they said, oh, we're not going to accept your master's in speech pathology anymore. So then speech therapists in a certain window for about 8 years or so had to get another master's and do all the things I just said. But now, because there's such a demand for BCBAs that they cannot fill all the positions because the field's growing so rapidly, they've gone back to saying a master's in speech pathology is okay. So that's nice because I provide supervision for people who are becoming BCBAs. And so there's a lot more speech therapists who are also doing that, which is like the best of both worlds, which is really cool. So behavior analysis is the science of behavior with a history extending back to the early 20th century. And its guiding philosophy is behaviorism, which is based on the premise that attempts to improve the human condition through behavior change. So education, this behavioral health treatment I've been discussing, will be most effective if behavior itself is the primary focus. So my focus as a BCBA, kind of my niche area, is really helping individuals who are not talking, or individuals who haven't acquired language despite them being in therapy. And so that's really kind of how I help as a BCBA. But there are so many different specialty areas. When you hear of a BCBA, you might think, oh, that's somebody who works with kids with autism. But that's really not the case. There's really a lot to it, and there's all these different specialty areas, and these are just some of them listed. But autism is a huge one. There's a lot of BCBAs that help students with autism. Like I talked about working in a non-public program, there are a lot of students who have unsafe or dangerous behavior. And so a BCBA can come in and they can do a functional behavior analysis, and they can say, well, why is this behavior occurring? And what can we do to make sure that this behavior doesn't occur? Because we want the individual to be able to learn and to be safe. Some other specialty areas, health and fitness. Anytime we're kind of like tracking things, if you've ever worked out at Orange Theory, I feel like there's a lot of behavior analysis in Orange Theory where you wear the monitor, you see your name up on the board, you see how you're doing in comparison to other people. There's just a lot of science and psychology involved in those. Organizational behavior management, it's not kind of how we're setting things up in the workplace. And then gerontology too. So there's a lot, and there's more than that too. BCBAs can work in a variety of different settings. So you could have a public school, and if it's a very large district, they might have their own BCBA. They could work in a non-public program like I talked about, like the school for students who have problem behavior that's unsafe, government agencies, and then private clinics. And what happens a lot of times is a BCBA might be employed by a private clinic, and there might be a public school student who is having a hard time at school, either not learning, engaging in unsafe behavior. And so that private BCBA might go in to the public school and act as a consultant. And that's usually how a BCBA operates. That's a majority of how BCBA operates. So they might be working with the student, but what they're doing is really kind of assessing, like, why is this behavior happening? What can we do to decrease that problem behavior so that the student can learn and that they can be in the school environment and things like that. So my journey, told you about the career test, got my BA and then my master's, and I became a speech therapist at 23. So almost 20 years ago. I can't believe it. I moved to Austin. I took courses to become a BCBA. I think I took my courses online. Yeah, I did, which was a long time ago, which was kind of back then, that wasn't always the case. I took my test in the fall of 2011, and then I became duly certified. So it's been quite a while. I love being able to help students in this very specific way. Because there's only 450 people worldwide that are duly certified. So a lot of people who are SLP BCBAs, I know, we've presented at conferences together. I have a teletherapy that we're launching later next month. A lot of the people that are working with me on that project are also SLP BCBAs. I thought maybe I'd go into the chat maybe to answer a couple questions. Let's see. One was, what is the recovery rate of autistic patients? I don't know if there's really a recovery rate, because autism, this person's always going to be autistic. They may increase their skill set. So maybe somebody that maybe their characteristics may not seem as autistic, but there's actually a big push in the autistic world, kind of autistic adults, this idea of neurodiversity. Just that's anybody. It's not just autism. It's anybody who has, ADHD or any kind of different brain, how your brain is working. That, they just are who they are. We want to be able to support them. I support from a communication standpoint, but they don't really talk about recovery. What are some ways you as an autism speech therapist help people along with spreading awareness? I do a lot of, I'm going to show you, but I do all the things on social media. I'm on LinkedIn. I probably have 15,000 people in my network on there. I actually do LinkedIn stories. That's like a thing on the app I just found out about. Instagram, that's where you found me. And TikTok, I'm on TikTok. Okay, so Rose ABA Speech. So I really disseminate a lot of information. I do a lot of public speaking. I love the podcast, because the podcast, we actually looked at my email list, and I have people from over 75 countries that are on my email list who are getting information about autism and communication. And I really love that. And there are definitely, if you go to abaspeech.org, I have a blog post with like a ton of different freebies. One I actually just shared on Instagram, ABA Speech by Rose, that's just general communication strategies, and a blog post that talks about, is it a language or speech delay, or is it autism? What are the characteristics of autism? What do they look like? And then sometimes we would treat those things exactly the same, but it's important to know those things. And this communication strategy sheet is nice for parents or anybody who has a child with a delay. Do I work with other types of therapists? Yes, absolutely. I work very closely with teachers, with outside speech therapists, with sometimes I'm the speech therapist on the case and there's a BCBA on the case. I don't really wear both hats. That's something good to point out. If there's a student who's very involved and there's a lot of people working with the student, I'm either the speech therapist or I'm the BCBA. I don't do both. So that's a really, really good question. And sometimes there's definitely like neurologists involved, depending on, that was more so when I was working in a non-public school where the students, had a lot of behavioral needs. And so they were, seeing a neurologist more frequently to get med updates and things like that. So, okay, good questions. Okay, let's see what else I was going to say. Oh, this is a YouTube that I did. That was a really cool kind of story that takes you through. It's very brief. But this is me narrating me working with a student and kind of the changes that I saw when we started working together with the student. And this is a student I saw in a non-public program.
I first met Timmy when he was 10 years old. Timmy did not talk. He did have an augmentative communication device, but did not use it. He was frustrated. His parents and teachers were frustrated too. As a speech language pathologist and board certified behavior analyst, I was contacted to help Timmy. I met together with a team of others, including Timmy's parents, teachers, and an intervention specialist to develop a plan by which Timmy would be able to functionally use his device across a variety of settings. First, I established rapport with Timmy by finding out what items and activities Timmy enjoyed the most. We found that jumping on a trampoline, eating chips, and watching movies on his iPad were among his favorite activities. I then added these activities to his device so that he could be taught to request them throughout the day whenever he desired. I made sure that the other members of his team were present during treatment sessions so that I could model how to work on communication. We agreed to keep data on Timmy's use of his device and to meet weekly to compare his progress. That was 4 years ago. Timmy now describes pictures, answers questions, and engages in a variety of leisure skills using his communication device. Another activity that Timmy now loves is going to his favorite restaurant and ordering a meal using his device. The power of hard work and collaboration with parents and other team members is amazing.
Okay, so that was a little story about a student that I saw in a private setting in the non-public program. When we first met him, he had a device. Actually, that's something we haven't even talked about, but there's a lot of iPads and there's certain programs that are on there that are buttons, and the students will press them to communicate. You might hear that called AAC device, augmentative alternative communication. And that's a big part of autism. Or a lot of students never verbalize, or if they verbalize, it's not their main mode of communication. And so that student, when he first came in, had very unsafe problem behavior, had to be staffed 2 adults to 1 student, and couldn't be around other students, couldn't work with females. I worked with him, but I always had somebody with me. And he had no way to communicate, wasn't using his device. And then he started using it. We would go on a lot of community-based outings. He would go to Dairy Queen and order with his device. And it was really, really amazing. That kind of specialized program in applied behavior analysis changed that student's life. And it changed his parents' life too, because then they never before, this kid was 10, they were never able to have a babysitter. He was never able to go to grandma and grandpa's house. And when he had that intervention, he had a decrease in problem behavior and an increase in communication. It was amazing. Okay, so a little bit about what I do now. I work 3 days a week as a public school therapist. I do a lot of assessment. I write individualized education plans. We call those IEPs. And I do a lot of collaboration with other teachers, either gen ed teachers, other professionals, guidance counselors, you name it. There's a lot of collaborating that goes on in a public school. And then 2 days a week, I work in my own practice, which is really nice because it's the best of both worlds. I can do things that are related to speech therapy, and I can do things that are related to being a BCBA. Oh my gosh, this is me at my same exact desk here. Those cards over there. So why I started my entire business is that, well, it was probably 5 years ago now. I had this idea for a therapy product. I had never made a product. It was just like something that I felt like people needed. And so that was my first product. It's called the Action Builder cards. It's a 100 set card. They are therapy cards that we use to help students with any kind of language delay increase their skills. And so I used a graphic designer. I found a printer. The whole thing was very exciting. We sell it on Amazon, my website. And I use it in therapy. It's used in a lot of different countries. So that's been really cool. And then once I got in the groove with that, I created another product. It's called Double Up. It's a game, and it's more for life skills students. So it's for students in middle school, high school, and it looks at vocabulary that's tied to leisure, and it looks at vocabulary that's tied to hygiene. Because that's really what kids at that age level need. So a big part of my job was getting like these distributors to sell my products, selling them on Amazon, and kind of just learning that whole thing. Like I had a designer, we worked together, and she helped me bring these ideas, what I knew I needed and other professionals needed, to life. And so it's really been cool to be able to have that distribution. Just this year, I took a course in the fall about how to make a podcast. And so I created a podcast. I've probably been a guest on, I haven't counted, but probably 15 podcasts. And counting. I tape a podcast, probably 3 new ones every single month for other people where I'm just a guest. And I talk all about autism and communication. And so I thought, gosh, I really want to start my own podcast because I want to do things the way that I want to. And I want to talk about the things that I want, that I think my followers or my email list, which I have about 20,000 people on my email list. So, I kind of have a gauge on what they want to learn about. And so in January, we launched it and it's been super amazing. I think episode 17 or 18 came out. Every single Tuesday, a new episode comes out, and it's all about autism and communication. So we've had autistic individuals on talk about their journey with communication. Our episode this week was a male speech therapist, which there's not a lot of male speech therapists. He's really popular. His name's Chris Winger, and he is a middle school, high school, or I think he's actually just a high school speech therapist, which there's not as many high school speech therapists out there. And so we had a great time talking about working with older students. I've had moms on who have autistic children. And it's just been such a great experience to be able to get information out that way. And people really, really seem to enjoy that. And I was telling you prior, I was like, oh, we're going to start putting it on our YouTube channel too at ABA Speech. So I'm getting a camera and like a new microphone and everything. So I'm very excited about that as well. Another big part of my work when I'm not podcasting, pre-COVID, like now I do a lot of talks like this, which is great because I get to see my kids more and I don't have to go anywhere, which I actually kind of enjoy. But pre-COVID, I would do a lot of presentations at conferences and just presentations for organizations and school districts and things like that. But this is a presentation that I did all about a student with autism. And it was all about that collaborative piece. And it was about the student who I told you lived in another country for 10 years and then came to the United States and had no way to communicate. So this was like my first professional presentation, probably 4 years ago. And it was crazy. It was like I was in Ohio and I had to fly all the way to California. And I had 3 very small kids, but I did it and it was great. This is me. Another big part of my job is going to conferences, and this is a distributor. They're called School Health. They sell like everything. And they had a booth at a conference. And so sometimes I'll like go to the booth. If I'm presenting, I'll go to a conference and oftentimes there will be a distributor there that's also selling my products. So I'll say like, hey, I could come by the booth. And I could schmooze with people and network and talk to people. And I really love that because people will come up to me. I think at this conference, I did a presentation and that's my Double Up product. This company sells both my products. And so I had some people come up and say like, oh, I was in your class at Kent State and it's a virtual class. So I had never met them face to face. So just things like that are nice to meet people and to be able to network and just talk about like how these products could help their clients. Or oftentimes people will come and tell me stories about how some of my resources have helped, which is nice because sometimes when you're in the online space, you're kind of like, is everybody out there? Is this helping anybody? This is me at a presentation. This is a really cool presentation, a presentation I did with 3 other SLP BCBAs at our national speech therapy conference, which for us is the largest conference. It used to get 20,000 people, which for speech therapy, that's big. I know there's conferences that are way bigger than that, but for speech, this is kind of the best conference. And I did a presentation with other SLP BCBAs, and we talked about this certain assessment called the BB map. And what's nice is the creator of this assessment sent me all the protocols for free, was so kind. And it was a hands-on lab. So people could come in, I could talk about the assessment, they could look at it. Because it's an assessment that not a lot of speech therapists give. Another part of my work life, this is more my BCBA side of me, is that I started another company with a business partner called Supervision Academy. So when you become a BCBA, you have to be supervised by somebody who already has their BCBA. And so you have to get, they've just upped it, but you have to get, I think it's 200 hours now. It's more, or maybe it's 100. I think it's 100 hours of supervision. And so people have to find somebody to provide that supervision. And a lot of BCBAs are very, very stressed and busy because the field's growing. There's not enough people. It's a stressful job. Sometimes you're working with people who have unsafe behavior. And so we specialize at Supervision Academy in providing remote supervision for people becoming BCBAs. So that's really been cool to kind of start this other smaller business and to be able to help support people who are becoming BCBAs. That's really been fun. Help me find my voice. This is a big part of what I do. I actually just launched this course this month. And this course is 5 hours long. It's for parents, it's for speech therapists, teachers, anybody who's working on communication with somebody who is not yet verbalizing or is an emerging communicator. And so this 5-hour course, this month we launched it. I did 3 webinars to give good information, to tell people about learning more. And we had over 3,000 people registered for those webinars. And that just wrapped up on Tuesday, and we welcomed 120 new people into the course, which is really cool. We have a private Facebook page. I can help people. Some people had signed up for like a coaching session, so I can meet with them and answer questions about the course information. This is how you guys found me, is on Instagram. I love Instagram. I don't know, it's kind of a toss up now between TikTok and Instagram, but Instagram's definitely been my jam. I remember making my first Instagram story, just like almost hyperventilating in my car. Now I'm like, okay, nobody even probably watched that story compared to now. Now my husband knows how to help me take an Instagram story. I play a lot of golf in the summer, so that's a big part of my Instagram in the summer. 3 years ago, he was like, what you wanted me to do? And now he's like, oh, this would make a great Instagram story. This would make a great TikTok. So he gets it, but it's a great way to disseminate information. This on the right-hand side is an autism diagnosis checklist. This was a freebie that I had on my blog at abaspeech.org. So I share information that is all about autism. That's really what my whole entire feed is about. Okay. This is a TikTok that I'm going to have you watch. So I have 2 TikToks, but this one is Rose ABA Speech. I have a TikTok for each of my businesses. I love TikTok. I got into it when COVID hit. We have a family account, and then that just kind of spilled over. I don't know if anybody listening knows who Gary Vaynerchuk is, but he says, you know, you should be on TikTok. This is a great way to disseminate information. And so now on TikTok, so I want to show you what this dissemination looks like on TikTok. Okay, kind of silly, but you know. Okay, do you want me to do this case study or answer questions? What do you think? Case study? Okay.
Yeah.
This case study is more specifically what I talked about with the student who was in 6th grade, had no form of communication, lived abroad, okay, for 11 years, had no problem behavior, had no unsafe behavior, which was great. Not what we usually see. I saw him in a public school. I was the school-based speech therapist. So the team members were a speech therapist, that was me, outside board certified behavior analyst from a private clinic, a teacher, intervention specialist, the autistic student, parents, occupational therapists, and then a paraprofessional or a one-on-one assistant, somebody who was working with a student to support him across his day. So this is from the article that I wrote about the student. And this was just kind of like his baseline, like how he was doing with some things, and then how he was doing at the time of this article, which was a while ago. And so when I first met him, he couldn't request anything. He was able to follow some one-step directions throughout the day, not in the building. He could not do that in the building. He could not identify items receptively. If I put like 3 items out and said, which one's the pen or where's the book? He wasn't able to do that. Couldn't do the same thing with actions. And he could do gross motor imitation. So gross motor imitation might be something like, do this one, or can you do this? If the student does it after me. So that was kind of at baseline when I first met him. Then we put together this intervention program for him. Like after our assessment, we worked collaboratively together. And then he was able to start verbalizing, which was absolutely amazing, which we'll get to. He could follow some one-step directions, like getting a book, going to the table, getting his snack out, just so he had independence across his day. He was able to kind of orient around the building with adult guidance. And then he was able to receptively identify some things if I put pictures out. And we would work on that skill to help a student increase their receptive vocabulary too. Fine motor imitation. This student really did not have a lot of fine motor skills. We worked really closely with the OT because the student wasn't able to point So we had to shape up this point to be able to activate things on the iPad and things for leisure. He wasn't able to eat independently. He couldn't eat in the lunchroom because he couldn't use, well, I get to that on the next slide. Sorry, I'm getting ahead of myself. Was able to imitate a couple little things like see, hi, bye. Was able to do a couple, no 2-word phrases. He would engage in group activities, but needed assistance. He liked watching movies, and he was not able to match anything. Then after intervention, he could do turn pages of a book. He actually loved literacy-based activities, which was so cool. He was able to imitate all different words, which was absolutely amazing, because usually when somebody gets to be older and they haven't acquired verbal speech, for them to be able to say the sounds that we say like we do is rare. So this is why this was kind of like my little star, this student. He actually moved this year. I was in a depression state for about a week. I was in denial, but it's a whole thing. I'm okay with it now. But he was able to do some new words. Then we put the words into phrases. It was really cool. He was able to do all different types of things for like a group speech therapy. We did things like play modified Uno. I actually just put that on my Instagram, but we would lay out the cards like one red, one yellow, one blue, one green. He would pick a card and just match the color for that student. That was like really big for that student. And he was able to do new things like take a walk with his class, watch videos, play different games with some type of assistance. And matching, he was able to match. Matching is such a great kind of early learner skill, because a lot of the times when the students get older, we work on competitive types of employment. And so matching, even just putting picture to picture or matching something that would go in a mailbox, these are things that are kind of like these pre-employment tasks. This student was on a toileting schedule. He was able to increase the time that he was on a schedule where he just used the restroom at certain times. Another thing that was really fascinating about this student is that when he came to us, he couldn't even eat in the cafeteria because he couldn't use utensils. He just used his hands, and he couldn't drink from a cup. So for 1 year, he ate with the one-on-one paraprofessional, with guidance from the occupational therapist about how to work on those things. And then after that year, then he was able to eat in the cafeteria with some assistance, but it was really, really cool to see that growth. So we did a shared assessment. We had shared goals among the team. So all team members were in the loop about the goals. We had streamlined data collection. I worked very closely with the occupational therapist. I worked very closely with the paraprofessional. The paraprofessional was able to help support my goals. And then I would go in and I would update the team on what we were working on, why we were working on it. And it was really, really collaborative. This case study 2, we had a 10-year-old student who was in a non-public program, like I was telling you, had no way to communicate, had very unsafe problem behavior. Very limited interest. This student, I would work with this student. This student didn't like anything that I presented. And this student did not like the iPad, which is mind-boggling, but didn't like light up toys, didn't like anything. We found out the student really liked music. And so he started communicating with pictures where he would have a picture of like a music and then he'd give it to me and then we would play music. Or he'd have a picture of a snack, he'd give it to me and then he would get a snack. And that's how we worked on that. And then he transitioned to the iPad, like I talked about the AAC devices where he touches a button and it says something, and that's how he communicates. So in introducing that level of communication, along with support from a board certified behavior analyst to see why is the problem behavior happening, how can we help decrease it, that really caused that student's problem behavior to decrease and his communication to increase. He was getting an hour of speech therapy every week. I was working really closely, so his communication targets and goals were worked on with other staff members when I wasn't there. So that was really cool. Some general recommendations. Every individual with autism is different. Ask preference. This is a very big thing, this idea of neurodiversity and autistic adults. And you really need to ask if you're working with anybody with autism, even if it's a person who's nonverbal, asking the family, like, Do you prefer me say a person with autism, or do you prefer me to say autistic person? Because people have very strong opinions about that. And so when I have somebody on the podcast, I always ask, like, how do you want me to address this? How should we say this? And I just go with whatever somebody's preference is. That's what I've been doing now. Allow time for processing. Some people with autism will have a slower processing time. And just because somebody is not making eye contact with you does not mean they're not listening. Don't force eye contact. It's not something that we should ever work on directly. It's a nice byproduct of kind of engagement and shared activities, but it's not something, just because somebody's not looking at you doesn't mean they're not listening. And then I thought maybe I'd go do this and then maybe answer a couple questions. But I really love being a speech therapist and a BCBA because my schedule is very flexible. So right now I work 3 days a week in a public school. With COVID, I've been going in 2 days. Actually, today is my virtual day, so that's kind of cool. And then Monday and Friday, I work on all things related to my private practice, ABA speech. I do my podcast, I do consultations, I do public speaking engagements. And so it's really nice because it works around my family schedule. Monday and Friday, I can take my kids to school. Every single day I can pick them up or they get off the bus. And that's important to me. So that's been really cool to be able to do that. All right. Want me to answer a couple more questions until, yeah, okay. Okay, let me see where we left off. Did that one. How does the average day on this job look like? When I work at a school, I get to school at like 7:30. I have a planning time. I, plan for the day, and then I just see students. Sometimes I see them individually. Sometimes I see them in a small group. I work at 2 schools, so I walk in between. I work in a very nice school district, so there's like a path. I just walk from one school to the other. Sometimes I have a meeting. But you have to be very organized in the job. It's very organized. You have to be very organized. There's a lot of paperwork when you work in a public school. At what age is autism usually diagnosed? The younger, the better, just because early intervention is very, very important, but that's not always the case. That's not always the case, which can be hard for the individual. I know that I sit on a lot of different conference review committees, and I've met autistic women, especially because girls and autism is something that kind of goes undiagnosed, because they used to say autism in boys is boys 4 to 1, but we don't think that's really true anymore. So I don't know what the current stat is on that, but I remember talking to an autistic adult who wasn't diagnosed until she was in her 30s. And it just really, really caused a lot of pain in her life to not get that diagnosis till then. How do you build a treatment therapy plan? When you work in a public school program, there's something called an IEP. And everybody, it's like, a federal document. We have to, by law, do an assessment. We have to, by law, have these goals. There's a certain way the kids qualify in a school-based program. And then we have to do the intervention like we said we would. It comes a law-abiding document. Is there technology that's used to help patients with speech? Yes, like an AAC device would be like even your phone, an iPad with a certain app that would allow the student to touch buttons. They could touch buttons to create sentences and even longer, that would allow them to communicate. I really love helping people, and I'm not good at math. So honestly, guys, that's why I became a speech therapist, but I love it. I love helping people. It's a great profession. Yes, the pandemic has affected my work life, but I actually really love I work from home one day more than I did last year. So I kind of like that. Because it's just nice. Like when you have kids, it's nice to kind of be at home to get things done. What are some ways that people with autism cope with society? That's really great. I think for every single person, it's different. I've heard somebody do a keynote once who was autistic, and she just said the way that people, like when we socialize at parties and how everybody kind of splits into little groups, and then, you kind of rotate and talk. That was really hard for her to understand. So I think every single person with autism is completely different. And some people have strengths in areas that are weaknesses for other people. So it's really going to be dependent on the person. Yes, so rare behaviors for students. Sometimes some students have had problem behavior that there's some students who would do this rumination where they would just kind of ruminate right here in their esophagus. I've seen students that would make themselves throw up because they were so upset about something or wanted to get out of a task or something. That's probably the most challenging behavior I've seen. There's some students who engage in self-injurious behavior. And so that's really unsafe behavior and definitely needs emergency treatment. How do you help autistic people growing up adapt well to society? I think just helping to be a support. And I think that's the thing too, is like, you know, especially with social skills, we're not trying to change anybody. We just want to be here to help support people. And I always tell my kids that I'm working on social skills. Think of me as your social coach. I just said this today, like social skills, once you get into middle school up through forever, are very nuanced. And I think a lot of people, even like with social media stuff, like, you know, you've met people who like maybe you're really outgoing on social media, then you meet them in real life and they're super quiet. And it's like that disconnect, right? It's just, I don't know. A lot of people I think would benefit from talking with a speech therapist. Let's see, how does speech therapy for autistic kids differ from non-autistic kids? Sometimes you're working on the same exact things. Like today I worked on social skills with a student who doesn't have an autism diagnosis. He just has a different diagnosis. So it just really depends on their assessment and how they're presenting. Major differences between working with children and adults is, I think, just making sure that everything you're using when you're working with adults as far as materials is age respectful. So when you're working with little kids, you might use a lot of clip art, you might use a lot of cartoon-like things. And then when you're working with older students, that's one of the reasons I created Double Up, one of my products, because it has real life pictures. And sometimes it's really hard to find materials that have those kind of age respectful things. What new advancements and technologies have been developed in the past few years that have improved how you do your job? I think this idea of teletherapy is absolutely amazing. I remember I just did a consult probably a couple months ago with a family who was stationed in a country that doesn't have any speech therapists, and they have a child who just got diagnosed with autism. And the mom felt very isolated and found me online. I was able to do a parent consult with her. And I'm very excited to be able to launch this teletherapy that we're going to be launching. That's another thing. Speech therapists, I'm licensed here in Ohio and I'm going to be licensed in Washington State, but I can only provide treatment in the states that I'm licensed. Other countries, it depends on the country. Some countries don't have speech therapists. Some countries don't care if I see a client in their country for speech therapy. Other countries, there's different things you need to do. So it can be a lot of barriers. So I think teletherapy is absolutely a game changer, especially for people who are living in an area where there's not specialized professionals. What inspired you to help people with speaking problems and autism? I really love helping others. And as soon as I found out about the field, I was like, yeah, this is perfect for me. I love this. And I really do. I love it. Every day is a great day. Let's see. Since ASD is a brain disorder, does it affect the normal development of children's brains? That I'm not really quite sure of the structural changes. I do not know. What do you think the future of ASD treatments will be like? I think what we'll see is really kind of this analyzing. We want to do a lot of dissemination in the world. That's why I like doing these talks just about like what, next week I'm doing one about just what is autism? What are the characteristics? Because I think we need to disseminate to the rest of the world, like to neurotypical people, like this is what autism is. But I think we need to help people with autism kind of navigate, like the idea of social skills. There's this idea of masking where, we don't want people with autism to feel like they can't be their true selves and to have anxiety over that. But I also want my children with autism and my students with autism to know that if they're in a situation that's competitive employment, even though we're going to disseminate about autism and we want society to be more autism friendly, that there are certain expectations for behavior and things like that. And I want them to be able to kind of code switch. Like when I'm at work, I act this way, I do this, even though I don't really care about what that person's talking about, I'm going to pretend that I do. And when I'm home, I can just relax. So that kind of code switching. So I think being more cognizant of holistically treating the whole person. Is speech therapy something that you need a diagnosis to get access to, or can anyone? That's a really great question. So in a school, you definitely have to have certain things, certain ways that you need to qualify for school-based therapy. But for speech therapy as a private practice, anybody could go and say like, oh, I really want to work on, the R sound, or I really want to work on the way I'm pronunciating this. You might benefit from speech therapy. So there's different rules. A private practitioner can see somebody for just about any reason. In a school, you have to have certain criteria where you would qualify for services. Yeah. Thank you guys so much for listening. Make sure that you touch base with me. If you're on TikTok, find me over there. Lord knows I need more followers. But tell people about the Autism Outreach Podcast. I really love sharing everyone's story and talking about autism and communication. And thanks so much for listening.
All right. Thank you so much, Rose. We really enjoyed having you on our platform. I learned so much about autism and about speech therapy in general that I didn't know before. And it was really nice listening to you. To all of our viewers out there, I posted the link to the Google form to submit for your shadowing hour. So once again, thank you so much, Rose, for joining us today.
Thanks. Bye, everyone.
Bye.